Good afternoon, everyone, faculty, friends, families, and most importantly, the incredible UC Berkeley Public Health class of 2025. Let me begin with a question I've been asked more times than I can count. What is public health? It usually comes up at dinner tables or during small talk right after I mention my major. Everyone's faces are a mix of confusion and curiosity. And well, to be honest, I get it, because I wasn't entirely sure myself when I first got here. 4 years ago, I arrived at Berkeley all the way from Mumbai, a city teeming with brilliant healthcare professionals, yet one where pollution, poor city planning, and glaring inequities are still a part of daily life. I came with a hope to understand and address these fundamental issues. I was 17, wide-eyed, eager, and very, very unsure of what I was doing. Like many other freshmen, I was all over the place. I was fascinated by everything, yet completely lost in the swirl of possibilities. But amidst this whirlwind, one thread kept pulling me back: healthcare. Not just in the sense of hospitals and doctors, but in the way health showed up everywhere: in classrooms and city planning, in prevention and research, in policies and protests, and in lived experience and legislation. Eventually, after a little soul searching and possibly a few identity crises, I realized my passion wasn't necessarily about treating illness at the end of the line. It was about tracing it back to the root. It was about understanding the systems, the structures, and the social conditions that shape health long before anyone enters a clinic. And that's when I found public health. The public health major at Berkeley didn't just give me knowledge, it gave me a lens, a way to see the world not just for what it is, but for what it could be. We didn't just ask what's happening, we asked why is it happening, who is it affecting, and how do we build something better? We came to understand that health isn't just the absence of disease. It's a collective, resilient, and proactive system. It's political, it's social, it's economic, and it must be fair. When I came to Berkeley at 17, my parents had every reason to worry about me navigating a new country all on my own. Would I stay safe? Would I be healthy? Would I be happy? But what I found here was more than just a campus. It was a community that took care of me, often in quiet yet powerful ways. The vibrant and walkable campus kept me active. Access to affordable and fresh food meant that I could nourish myself without compromising my health. Prompt health services supported me even in the most urgent times, like the night I had to be rushed to the ER. Our campus police and fire departments were always there, whether it was to escort me home safely at night or showing up again and again for my apartment's overly sensitive fire alarm. There was beauty in the clean air, even when it was unbearably freezing and windy. Uplifting public spaces, mental health circulars reminding us we weren't alone, and professors offering empathy when life got overwhelming. So many invisible forces came together to make sure we felt healthy, safe, and included. And through my public health education, I began to truly see and appreciate it all. I realized this is what systems working together look like. And behind them are public health professionals and advocates making the impossible possible. This is what real health feels like. And still, I don't know if my parents truly know what public health means, even as they watch me graduate today. But they know it means something to me, and that's enough. Thank you, Mom and Dad, for always supporting my decisions, for your unconditional love and support. I owe all my achievements to you. To all my friends and family here at Cal and back home in India, thank you for being the most heartwarming and uplifting community I could have ever asked for. And to the inspirational faculty, thank you for widening my perspectives through your invaluable experiences and guidance. Now, I won't pretend that the road ahead is easy. We're entering a world that's complex, politically polarizing, and often discouraging. But I have faith that the need for equitable and accessible healthcare will always outlast resistance. That truth, care, and justice will always have a place and a voice. And I have faith in us, this class, because I've seen us in action. I've seen my peers lead harm reduction projects, build innovative health technologies, fight for reproductive rights, and challenge deeply rooted systems with courage and grace. I've seen brilliance paired with humility, passion turned into purpose. So, what is public health? It's right here. It's us, the curious, the compassionate, and the relentless. The ones who believe that a healthier world is not only possible, it's necessary, and we're not afraid to build it. So congratulations, class of 2025. The work begins now, and I wouldn't want to do it besides anyone else. Fiat Lux and Go Bears.